So welcome to our second lesson, and in today's lesson we will look at the cause, the symptoms, and the control measures of Newcastle disease, fowlpox, Gumboro disease, African swine fever, blood and milk fever. Now Newcastle, fowlpox and Gumboro, those are viral poultry related diseases. The African swine fever, it is a viral disease related to pigs, but the rest, that is bloat and milk fever, those are nutritional disorders. So in our today's lesson, that is what we are going to cover, starting with Newcastle disease. Now Newcastle disease, it is a viral disease, and it is a very contagious disease, meaning that it can be passed through contact. It is also an infectious, meaning it can be caused by a virus, that is an infectious causing organism. And normally when Newcastle attacks, all birds that are affected, they mostly die. Something else to note about Newcastle, it is a notifiable disease. Notifiable meaning, in case of an outbreak, the authorities must be notified or informed. And these authorities are like the veterinary officers, the police, the provincial administration, that is the chief. And the reason for notifying them is to take the necessary measures. The animals attacked, this is a disease for the poultry, and mostly the poultry that is attacked, it is between 3 months and 1 year. 3 months and 1 year. In between there, they are commonly attacked. So if you look at the image of this chick, you can see the way the neck is strained. You may think it is as a result of manganese, but if you look at keen, you will see the eyes are closed. Also, another indicator is the dung, the dropping. The color of the dropping is green in color and in diarrhea. So this one can be seen when animals are, maybe they are still alive, they are not yet dead. So if you find such, then you can be sure your poultry are suffering from a Newcastle disease, a very dangerous disease. Now, what are the symptoms? One symptom that you are going to see is difficulties in breathing. So the bird will start having difficulties in breathing. It will produce some harsh or rapping sound when breathing, a very sharp sound. Next, you will see the beaks. Their beaks will remain open and the neck will strained. So the beaks are open, the necks are strained. The animal will become dull. So even when you are feeding, the animal will be reluctant even to move. Then something else is that the eyes will always be closed. So you find that the bird is the mouth is open, the eyes are closed. Something else, the neck is strained. Something else is that the bird will lose appetite. The bird will lose appetite. Then we will have some nasal discharge. Mucus will come from the nostrils, and the birds will shake their hands to clear that mucus. Something else, because this disease affects the nervous system, the birds will appear as if it is staggering. So it will walk with a staggering motion. Something else is that the wings and the legs may paralyze. Something else, and mostly the reason of paralyzing, it is because of the effect of the nervous system being affected. Something else is that the birds will have their beaks and wings down. So the beaks and the wings will be facing downwards. The bird will produce a watering greenish diarrhea, as you have seen. Something else, if it attacks birds that are still laying, they will produce a soft-shelled eggs. Now remember, we have another cause of soft shell, that is inadequate calcium in the diet. That one can be one cause of soft-shelled eggs, and also Newcastle disease. So those are the symptoms of Newcastle disease. So when you see them, please take immediate action, because this disease can wipe the entire flock of birds. So how do we control? One, we kill all the birds and then we dispose them properly by burning. You kill and then you burn. So when you start seeing symptoms, because it spreads very fast, to prevent that spread, then kill the birds and bury them. Something else is ensure that you clean and disinfect the poultry house, before bringing new flock. So before you introduce new chicks, ensure the house is clean. Ensure it is clean and disinfected. That is to ensure the house where you are bringing in new chicks, it is free from the virus. The other one is carry out vaccination, mostly between the 6th week and 2 to 3 months after. So that is why when chicks are young, we need to do a lot of vaccination just to prevent these diseases. Lastly, being a notifiable disease, one control measure is quarantine. So quarantine is very important when you know a disease is notifiable. Now, one thing about Newcastle, we do not have any known treatment for this disease, and that is why control measures are very important, because if the disease attacks, then you can lose the entire flock. So that is Newcastle. And if there is a question, just inbox the question about Newcastle. Okay. So let's look at the next disease. That is fowl-pox. Fowl-pox is also a poultry disease. So it attacks all kinds of poultry, from the chicken, the turkey, the pigeons, all the birds. And the virus that causes fowl-pox is called the avian fox virus. Avian fox virus. And the incubation period is 3 to 14 days. Now, the predisposing factors for this disease one is presence of wounds. Because if we have wounds, what will happen is that the virus can easily get through the wounds. Then we have presence of mosquitoes, ticks, lice, and other biting insects. These ones may spread the disease. So if they come and bite the sick bird and they go to another healthy bird, they may spread the virus. So that is the fowlpox, the predisposing factors. Now, how does fowlpox manifest itself? How will you tell the bird is suffering from fowlpox? By looking at you can look at the legs. The legs will have some wounds. The legs will have some wounds. It will have some wounds. These are the wounds, what we also call lesions. Also on the combs, you see some lesions, the wounds. First of all, they appear as if they are water soaked. Then later they turn into wounds. So when you see such, then you can be sure your birds are suffering from fowlpox. So these are indicators of fowlpox. Okay, so if you happen to see such, then be sure the birds have been affected by fowlpox disease. Now, what are the symptoms? Now, as you have seen, we have some injuries or wounds or lesions. They are observed on the combs, the wattles, and first of all, they appear small and grayish white. Then, as time goes, they become yellow, brown, and then they also increase in size. Now, these lesions may occur on the legs, on the vents, on the feet, and also under the wings. Now, something else is that this disease can also affect the alimentary canal. So, but that one now will be very difficult to see. You'll only see now symptoms like loss of appetite, dullness, and also emaciation. So those are the symptoms of the disease. Now, how do we control them? Now, this can be controlled by removing all the affected animal birds and killing them. And remember, when you kill, you must bury or burn. The remaining healthy birds should then be vaccinated. So the ones that are affected, you remove and kill. The ones that are healthy, you can vaccinate. Maybe something worth noting is that you also need to also control the wounds. Also control the wounds. So control the wounds. Control the wounds because we have seen the wounds. They are predisposing factors. So you can also control them to prevent the entry. So that is fowlpox disease, a viral disease, but it is not as dangerous as the Newcastle disease. This one can be treated especially if it is noticed early enough. Any question there? Okay. Now we move on to the last poultry viral disease known as Gumboro. Now Gumboro, it is referred to as Gumboro because it was initially, or it was discovered in a place called Gumboro. That's why it's called Gumboro disease. Now this is again a poultry disease affecting chicken, turkeys, pigeons, ducks, etc. All classes of poultry. Now it is caused by a virus referred to as Bina virus. Bina virus. Bina virus. Now, this disease, what happens is that it will affect the B lymphocyte. This is a white blood cell. It affects the B lymphocytes, meaning that it is going to weaken the immunity of the bird. And the B lymphocytes are found in a gland above the vent of the bird, known as basa or fibricus. Basa or fibricus. That is why where we have the B lymphocytes. Now, when the lymphocyte is affected, it will also have an effect on the thymus. Remember, thymus has a lot of control in various activities. It will also affect the spleen that stores blood. It will also affect the cecal tonsils. So meaning that in the cecum, it will affect the absorption of water. So the incubation period of this disease is 2 to 3 days. So it's very short. So what are the how does it appear, or where is the basa of fibricus? So if you look at this bird, where we have the cloaca, also known as the vent, you are able to see, you can easily see this part. This part is the one that we call basa of fibricus. And when it swells, it will have a lot of effects, especially on the alimentary part of the bird. So this is the basa, and it is the one that will swell. So what are the symptoms? The first one, and this is the most common, the swelling of the basa or the vent. The gland above the vent will swell. The gland above the vent will swell. So this one is very common, especially in chicks. Now, birds that are producing eggs, the egg production will decrease. It will decrease. Then the birds will develop respiratory distress. That is, it will have difficulties in breathing. It will have difficulties in breathing. Then there is loss of appetite. Loss of appetite. Something worth noting is that the birds will show low water intake. So even if they are feeding, they will show low water intake because Remember, the cecum is affected. The cecum is affected. So those are the symptoms. Something else to note is that this disease will affect the immune system. So there will be severe immunosuppression. This will make the bird now easily attacked by other diseases. So it will be more susceptible to other diseases. And that is why it is referred to as poultry ants, because it will suppress the immune system. Now, normally, if the weather is very hot and also when there is high humidity, the death rate is very high. The death rate is very high. So it increases with the increase in temperature and also humidity. So the symptoms, one, we have said the gland above the vent will swell. There will be decrease in egg production. There will be respiratory distress or difficulties in breathing. There will be loss of appetite. There will be low water intake. Those are the symptoms of the disease. Now, what are the control measures? The control measures, one, vaccinate. So I think you have noted that all viral diseases, one control measure is vaccination. That one is common in all viral diseases. Vaccination. So you vaccinate the birds that are not showing the signs with the high attenuated vaccine like PG B98. Then you give vitamins, especially vitamin B12, for faster manufacture of blood. Remember, we have said this disease affects the white blood cells. So that's why you need now to provide vitamins so that the synthesis of blood can be very fast in order to now develop other white blood cells. So those are the control measures. Also, I noted that the disease result to severe immunosuppression in poultry, increasing chances of opportunistic diseases, and therefore the disease is also referred to as poultry ants. So that is Gumboro disease. Any question? Okay, good. Now we go to the last viral disease known as African swine fever. So African swine fever, this is a disease for the pigs, and more so the female pigs. So it is caused by a virus known as iridovirus. Now, the incubation period is 5 to 15 days. That is roughly 1 to 2 weeks. Something else to note about this disease is highly contagious, meaning that it can be spread through contact. It is infectious because it is caused by virus, which is an infectious disease-causing organism, and it is fatal. Fatal means it causes death. It is a fatal disease. In fact, this is a notifiable disease also. It's a notifiable disease, meaning that in case of attack, the authorities must be informed. So this is a disease for the domesticated pigs and more so the female pigs. Now, something to note about this disease is that the virus is highly resistant to putrefaction heat. So even if you put it in, for example, a refrigerator or a place that is very dry, the virus can still survive. And that's why we are saying that even in the carcass, maybe you have bought meat or you have slaughtered your pig, then you have put it in a refrigerator. It can stay there for 6 months. So it's a very dangerous disease. The virus can stay in hard areas like very cold areas or areas with high temperature. Symptoms of attack. The first one is there is rise of temperature, that is fever, and it can go up to 40 to 41 degrees Celsius. So it's very high. Then the pig will lose appetite. It will appear depressed. It also becomes very weak. So generally it will appear very weak. Then it will start coughing. And then if you look at the nose, you will see some mucus, what we call the nasal discharge. The nasal discharge. And then in serious cases, the pigs can also start diarrheaing. So those are the symptoms: the rising in temperature, the loss of appetite, the pig becoming depressed, the pig appearing very weak, then the pig starting to cough, then the nasal discharge from the nose, that is the mucus, and also diarrhea. But diarrhea occurs in case of serious illness. So when you see diarrhea, then be sure your pig is about to die. So this is how it looks like. If you look at the pig, you can see it appears as if it is red because of the high temperature. The high temperature is the one that is making it appear like this. It is the one that appears makes it appear like this. So what are the control measures? As normal, vaccinate in case of an outbreak. Again, being a notifiable disease, impose quarantine. Then kill and dispose the affected animals well. And we said we kill and dispose by burning. We burn the carcass. Then prevent the consumption of pig products from pandemic areas. So if you know, for example, a certain area there is an outbreak of this disease, please avoid consumption because that one may be a way of spreading the disease. Then carry out double fencing to keep wild animals away. Please note it is double fencing, not just fencing, but double fencing. Double fencing is whereby you put a fence, one fence there and another one there. So in between here, you leave a space. So if your animals are grazing here and the wild animals are here, then you can see even if there is a virus, that virus before it gets to your animal, it will have starved to death. So that is the reason why we do double fencing. we do double fencing, and that marks the end of the viral diseases. I think you have noticed something about viral diseases. One is that most of them are notifiable. They are like the rinderpest, the foot and mouth disease, Newcastle disease, and African swine fever. I think the only two, smallpox and Guboro, are the ones that are not notifiable. And therefore, noting that they are notifiable, then we have three key control measures: vaccination, imposing quarantine, killing and properly disposing the affected animals by banning. So that is one, just a common control measure for those diseases that are notifiable. But all in all the viral diseases, both notifiable and the ones that are not notifiable, there is one common control measure, and that is vaccination. So that's the viral disease. And if there is a query there. Okay, so now we can move on to the nutritional disorders. Now, these nutritional disorders, they are non-infectious. Non-infectious means they are not caused by the infectious disease-causing organisms, that is the pathogens. So they are non-infectious. Non-infectious means they are not caused by disease-causing organisms, or what you call pathogens. Now we have two. We have milk fever, also known as purulent paresis, and then we have bloat. These are two common nutritional disorders, though we have other nutritional disorders, but these ones are of economic importance, because if they attack the animal, you can lose the animal, and that one will really affect your income, for example. So we start with the first one, known as milk fever. So milk fever is also referred to as purulent paresis. Now it is caused by low calcium levels in blood. That is the cause. Now when we have low calcium levels in blood, that one will increase magnesium and sugar level in blood. So the cause, just note the cause: low calcium levels or inadequate calcium level in blood. Now this disease can affect mainly the cows, goats, pigs, which have recently given birth. But of economic importance is dairy cows, because remember, these are the ones that produce a lot of milk, especially the few months after lactating or after giving birth. So yeah, it mostly occurs in high producing cows in the first months of lactation. So when they give birth, the first months, few months, around 3 months, is very common, because that is the time they produce a lot of milk. Again, remember, the fetus and consumed some of the nutrients. So if something is not done, then the animal can suffer from milk fever. Something else to note is that um, the animals lose a lot of calcium through milk secretion. Remember, milk is made mostly of calcium. That's why it appears white. And therefore, if the animal is not getting enough calcium from the food, then that one can increase than disease. So the diagram shows a cow suffering from milk fever. That is what you call recumbency. Look at the neck. The neck is twisted backwards. This one, when you see your animal behaving like this, and obvious combined with other symptoms, then you can be sure that the animal is suffering from milk fever. But remember, recumbency can be brought about by other causes. But if you see recumbency plus now other symptoms, then that one can guide you to examine your animal and also conclude that your animal is suffering from milk fever. Suffering from milk fever. What are the symptoms? Now, these symptoms, I want you to note this. They are shown from 12 to 72 hours after the cow calves down. So after the cow gives birth, you may start seeing these symptoms. And you must be very, very, very keen. You must be very keen. You must be very keen to note. Otherwise, you may lose your animal in the process. And remember, we have seen these animals. They are animals that produce a lot of milk. They produce a lot of milk. So the first thing is that the animal will become dull. So there will be dullness. You approach the animal does not bother. Then the muscles. So there will be muscular twisting. So the animal will start trembling. It will start trembling because the muscles are affected. Then the animal will move in a staggering manner. So there is staggering as the animal moves. Something else that you'll see is that the animal will become unconscious and it will fall down. So it will fall down and become unconscious. Something else is that the animal lies down on its side. Remember, it is unconscious. It will lie on its side, and then the whole body will stiffen. It will become stiff. The whole body will become stiff. Something to note is that all body functions like urination, defecation, milk secretion will stop. So the animal will not urinate, the animal will not defecate, the animal will not produce milk. And in fact, because of, for example, a lack of urination and defecation, this one will increase death. Another one is sudden death. This is a symptom. Sudden death if animal is not treated immediately. So the animal will die within 12 hours. You can lose your animal. Then the stomach contents. Maybe they are eaten some grass or food. They will start coming out from the mouth, and those stomach contents may enter the windpipe, then get to the lungs, and that one can encourage the lung fever. So that is very serious. Then lastly, the animal loses appetite. So complete loss of appetite. Complete loss of appetite. So there is no appetite at all. So those are the symptoms. Very common in animals that are higher producers, especially when they when they give birth. Immediately when they give birth, within the first 3 months, it is very common. But and you can see those signs can start even as early as 12 hours after birth, especially those animals that were not well steamed up when they were pregnant. So those are the symptoms. Now we look at the control measure. How do we control male fever? One, we can do partial milking. So the first 10 days after birth, you do partial milking. That is, you milk after every 2 hours for a few days. So you milk more frequently, but you don't finish the milk in the under. You milk bit by bit. Number 2, you give high-yielding cows rations containing phosphorus and calcium. So you ensure they are well fed with calcium and phosphorus by providing minerals or minerals that are that have a lot of calcium. You can also give some forage crops like lucerne because it has a lot of calcium. So that is number 2. Number 2, under control measures, you can also do some nursing. When the animal is sick, already it is now infected, you can do nursing care by keeping the sick animal in a comfortable position, that is resting on its sternum. You allow it to rest on its sternum and not the side, because when it rests on the side, that one can make it even difficult, for example, to breathe. Then you can also do mechanical removal of urine. You remove the urine using syringe, and then you can give fresh water. These are nursing care points. You sit the animal or ensure the animal is in a comfortable position, that is resting on its sternum. You remove urine from the urinary bladder mechanically, and also give fresh water. You give fresh water. Now, something to note is that animals suffering from milk fever should never be given medicine through the mouth. So never give medicine through the mouth, because one, the animal will not be able to swallow the medicine. Remember, the animal is unconscious, so it will not be able to swallow the medicine. Number 2, another reason is that the medicine may enter into the lungs. So as it is swallowing, the medicine may get into the lungs, and that one can promote lung fever, which will speed up the death. So those are the 2 reasons why medicine should never be given through the mouth. One, the animal is unable to swallow, so it cannot swallow the medicine. Number 2, in the process, the medicine may get into the lungs, and that one can promote fever, the lung fever, and that one will speed up the death of the animal. So that is why medicine should never be given through the mouth. That is the nursing. Now we go to treatment. How do we treat if the animal is already attacked? One, we give intravenous injection. So we inject the soluble calcium salt that is in form of calcium boron gluconate, 16 grams, through the veins. So we do it through the veins. You inject into the veins, and normally that soluble calcium should be dissolved in 500 centimeter cube of water, which is boiled and then cooled. Then now you can inject. You can inject. That is one way of treating, carrying out intravenous injection of soluble calcium salts. Next is bloat. So we look at the last disease. The last disease, that is bloat. Now bloat is accumulation of gas in the rumen because of food fermentation. So that is what you call bloat, meaning that the gas does not come out. The gas does not come out. And mostly the animals that are attacked by this disease, they are the ruminants, because they are the ones that have the rumen, like cattle, sheep, and goats. Now, what are the causes? Now, bloat can be caused by various ways. One, obstruction of the esophagus. So the esophagus can be obstructed, meaning can be blocked, and can be blocked by bulk food particles, like if the animal feeds on potatoes, if it feeds on carrots, if it feeds on mangoes, those bulk food particles, as it is feeding, for example, if it is unable to chew well, they can get into the esophagus and it is blocked. So when the esophagus is blocked, the gas now from the rumen cannot come out through the mouth. Number two, it can be due to abnormal pressure exerted on the esophagus by swelling in the walls of the chest. So when the chest swell, they exert a lot of pressure on the esophagus. So that means that the esophagus will be blocked in a way because of the swelling. And again, the gases now from the rumen will not be able to come out. The other one is indigestion. Indigestion, this is whereby now the food is unable to be digested properly, and this one now can cause accumulation of gases, because one, if for example the animal feeds on poisonous plants, the rumen may get paralysis. So there will be paralysis of the rumen and also the valve. So when the rumen paralyzes and also the valves, the function of the rumen now is interfered with. Then another one is sudden change of fins, especially soft, green, or ash pasture. So this one again, it will lead into the indigestion, because the food is very soft, and when grass, for example, is very soft, it has a lot of water. And that one now can encourage fermentation. That means there will be excessive production of gases, and those ones now may encourage bloat. So that is those are the causes: obstruction of the esophagus by bulk food, abnormal pressure exerted on the esophagus, then indigestion, which can be due to paralysis of the rumen, and also can be due to soft, green, or lush pasture. So look at the animal, the left side of the animal. The stomach is distended, and if something is not done, the animal can die. The animal can die. And please note the difference between bloat and anthrax is that in anthrax, the stomach will be distended, but you will see blood coming out of the nostrils. But in bloat, the stomach will distend, but there will be no blood. So those are the differences between the two. Okay. Let's look at the symptoms. One symptom is that the left side of the abdomen is excessively distended. This one is the symptom that can help you detect when the animal is suffering from bloat. Again, remember there is a difference. For the anthrax, the stomach will distend when it dies. But for the bloat, this one will be seen when the animal is alive. And when you press the abdomen, then you will feel that the abdomen is full of gas. Something else that will occur is death. So death will occur within a very short time, and this is because there is too much pressure exerted on the blood vessels, the lungs, and the heart. So the death will occur because of this. Because when there is too much pressure, then the flow of blood will be interfered with, the working of the lungs will be interfered with, and also the heart. But the first one, this is the one that will tell you that the animal is suffering from bloat, the distended abdomen. How can we control now? Now control, you can do it in various ways. It can be done in various ways. So under control, this is what is done before or to prevent the occurrence of bloat is by feeding the ruminant with dry roughages. So even during the wet season, when there is a lot of green pasture, it's normally advisable to include dry roughages, especially in wet season. That is control. Now treatment. This is done when the animal has already gotten the disease. So there are various ways. One, you can do manual means by exercising the animal. You can exercise the animal. So you run the animal up and down, and in the process, you rub the animal with your hands and making some prodding movement with your fist, just to stimulate the rumen to remove the gases. That is manual. You can also do surgical. So when there is excessive accumulation of gases, you can now inject the gases by one, using stomach pump. So you can inject the pump. You can inject the pump through the esophagus into the rumen, or you can pierce the abdomen wall You can pierce the abdomen or using the trocar and canura. You can also use sharp knife or a spear end. Those are two ways of doing it surgically. By injecting using the stomach pump and also piercing the abdominal wall, and by using trocar and canura, sharp knife or a spear end. But the second one, that is use of the abdominal piercing, that one should be the last resort. That is surgical means. We have also chemical means. We can have some chemicals. One chemical means is drenching the animal with suitable oils. So you give animal some oil. Like for example, you can give it turpentine oil. You mix it with vegetable oil. Now when you give the animal, the oil will encourage the animal to diarrhea. And as the animal diarrheas, then it will relieve the animal of the excess gas. Another one is administering Epsom salt. This one again helps to clear the remaining rumen content. And we normally give it as a drench, meaning you give it through the mouth. So you mix with water, then you give it. Again, the animal will diarrhea and the rumen content will be cleared. Then administration of methyl silicone as an injection. So you inject directly into the rumen, and this one will prevent a floathy or bubble type of bloat. This one is by increasing the food tension in the rumen. So these are 3 chemical ways: using suitable oils, Epsom salts, and injecting methyl silicone into the rumen. So those are the common measures of bloat, the chemical measures. So you can see we have the manual measure, we have the surgical measure, and also we have the chemical measure. So before you go to the surgical, try manual and also chemical, because these ones are easily available. Remember, when you do surgical, you may affect the animal, because maybe when you are piercing the animal, you may pierce wrongly, then it will get a wound, etc. So before you go to the surgical means, then try other means. So that marks the end of bloat. That marks the end of bloat. So these are methods. Some of the methods that you can use. You can use a pump. You can use a pump. You can pierce with the trocar and canura. You can give vegetable oil. You can give Epsom salts. So you can give any of these. But I've said the use of trocar, the use of pumps should come as the last resort. Should come as the last resort when other means have failed. So you can try these ones because of vegetable oil. Maybe in your kitchen you have some vegetable oil, give it. Epsom salt is sold in the nearby agrovet, give it before you go to the surgical measures. So up there, that marks the end of the diseases, the livestock diseases. That is the protozoan diseases, the bacterial diseases, viral diseases, and nutritional disorders. So tomorrow we will do a quiz on the livestock diseases. So tomorrow prepare for a quiz just to test whether you have grasped the content on this topic. So up there, I want to wish you all the best. Let's meet tomorrow and prepare for the test. The test will not take long. So, and our test will start tomorrow at around, we can have maybe 1 hour, maybe from, let's start the same time, 11 to 12. So thank you and have a good day. If there is a question, please put it on the inbox. I'll be able to respond to it.